Good afternoon, everybody. Thanks so much for joining us. We spend so much time talking about how to integrate oral health into primary care, but here we are today to talk about integrating oral health into the prevention of non-ventilator associated hospital-acquired pneumonia that we fondly and will call NVHAP. And the focus is on how to prevent this in acute care settings, but also think about long-term and home care settings as well. And I'm going to turn the presentation, the first part of the presentation, over to Jessamine, who is going to introduce and walk us through the first part of the program. Jessamine?
Thank you, Judy. So I am Jessamine Cipollina. I am the program manager for the Oral Health Nursing Education and Practice Program, also known as Onup. And Dr. Judy Haber is the executive director of Onup, and we're based at the NYU College of Nursing. And today, like Judy said, we'll be talking about NVHAP, which we will be calling it throughout this presentation, so we don't have to keep saying non-ventilator associated hospital-acquired pneumonia. NVHAP, much easier for everybody. So the aim of the Onup program is to expand the oral health and interprofessional workforce and increase integration of oral health content into nursing and other health professions, like curricula and clinical practice. The resources that we develop, as well as that our oral health champions and our interprofessional oral health partners develop, all these resources that we promote are there to establish oral health as a standard of care across health professions that are outside of the dental profession. So we have faculty toolkits for curriculum integration of oral health competencies and content, webinars, presentations like this one, case studies that we've created, and many, many publications that we've written over the years and publications from our partners over the years. All of these are available at the Onup website at onup.org. And all of these resources are easily integrated into education and clinical practice settings across the non-dental health professions. So prevention and management of NVHAP calls for an interprofessional team. Dental and non-dental providers all have significant contributions that they make in caring for their patients, thinking about screening, patient education, patient counseling, and any management of effects of any treatments that they're in. And you can see we have a huge, large, diverse workforce of nurses, nurse practitioners, midwives, physicians, physician assistants, and the dental workforce as well. And it's a blessing to have such a great diverse workforce across the US, and communication and collaboration among these professions is absolutely essential in management of oral care issues. There are purposes in NVHAP. So non-dental providers and dental providers, but thinking about nurses, nurse practitioners, all of these that are listed, all of these professions can easily incorporate oral health into their assessments with their patients and as part of their management planning with their patients. We have this great diagram that we like to show, showing whole person care, and that we see the patient is at the center of this, and all providers that are involved in the patient's care are linked to the patient and as well as linked to one another. A lot of times these models will be about dentistry and dental hygiene, but we work to include these as components of the medical care and medical and dental care team, because all members of the healthcare team have a significant role to play in providing the best possible care for their patients. The oral health delivery framework shown here was created by the Qualis Health team in 2015. The team consisted of interprofessional oral health, nursing, all sorts of health experts that collaborated to develop this framework, which is provides kind of a simple way of remembering to include oral health in the assessment and care of patients, and establishing that providers need to be asking about oral health issues as part of the health history, even if they're outside of dental care. So the ask component, looking about asking about oral health issues and any sort of risk factors as part of the health history, looking for signs and symptoms of oral disease, incorporating oral health and any oral health issues that come up as part of the decision making and when deciding on the next steps for the patient's care, and especially including oral health in any documentation in EHRs and any sort of communication with other providers. And the documentation component is especially important in making oral health present and becoming more widely accepted throughout healthcare systems as part of this action plan and as part of management in patients. Our seminal Putting the Mouth Back in the Head, Heat to He Not article. This was written back in 2015, and since then it has been cited in many publications, policy reports, national reports, including the newest Oral Health in America report that was published by the National Institute of Dental and Craniofacial Research and the National Institutes of Health as a 20-year follow-up to the 2000 Oral Health in America report from the Surgeon General back in 2000. So that's been a really significant move for us for bringing the mouth back into the head in terms of moving the HEANT exam, the head, ears, eyes, nose, and throat exam, to moving it to the He Not exam. So that's the He Not method continues to be used as a standard of care in primary settings, acute care settings. And with this article and the message here, the most important takeaway is that with the He Not exam, you cannot forget to include the mouth in the standard head and neck exam. So the oral health and overall health are inextricably connected to one another. This diagram shows how the oral systemic connection is present in many overall health conditions, heart disease, diabetes. These are all things that Onup that we have published on, presented on widely. But today we're focusing on lung conditions, taking a closer look at NVHAP. So NVHAP is the most common hospital-acquired infection in the US. And even though it is one of the most common and morbid healthcare-associated infections, it's not often tracked or reported by healthcare systems, which is something we'll talk about a little bit more later. But multiple episodes of healthcare-associated pneumonia, or HAP, can occur in critically ill patients or those patients that have lengthy hospital stays. And you can look at these stats and see that increased morbidity, mortality, extended length of stay, increased cost to the hospitals, increased likelihood of readmission. These are all really significant statistics because they're also a lot higher than other common hospital-acquired infections. So thinking back again about the oral systemic connection of oral care and pneumonia, we know that the mouth is the primary source of infection in a hospital setting, as it's the gateway to the rest of the body, which is why oral care is so important. Around, I think, 70% of hospitalized patients were reported to not actually receive any sort of basic oral care while staying in the hospital. And this leaves the mouth especially vulnerable to infection and plaque buildup. And so we know that we can see that the primary source of pneumonia is bacteria that's present in the oral biofilm. What happens is any dental plaque buildup in the mouth, it becomes a hub for any sort of bacteria and pathogens. And the buildup and any bacterial overgrowth, any sort of infection in the mouth, minor, major, or otherwise, along with the fact that patients are often bedridden and lying, flat a lot of the time. All of these increase the risk for NVHAP. And so reducing the actual amount of bacteria in the mouth through consistent oral care, brushing teeth, flossing, any mouth rinses that can be used while patients are staying in the hospital. These are all shown to be associated with a significant reduction in the incidence of NVHAP in hospital settings. Excuse me. So how exactly can the non-dental and dental healthcare teams make a difference? How can the entire medical dental team make a difference in reducing the incidence of NVHAP? The most important takeaway is that patients need to be receiving regular oral care, be educated on maintaining regular oral care with consistent toothbrushing, flossing, and denture cleaning as needed. All of these other bullets are steps that the care team can take to minimize the incidence of NVHAP and minimize the risk for NVHAP. Both dental and medical professionals, through these kinds of models, have an opportunity to collaborate with one another. Thinking again about the interprofessional team, each health profession can educate their patients, patients' caregivers, faculty in an education setting. They can educate their students and across healthcare professions about oral care methods, and mainly, again, focusing on proper oral care to keep the mouth clean and free of harmful bacterial buildup. And this is all essential for preventing NVHAP. And now I will turn it over to Dr. Haber to tell us more about NVHAP developments in prevention and policy related developments as well.
Thanks, Jessamine. So I would like to tell you about a VA initiated program for the prevention of NVHAP. It was called Happen, Project Happen. It was a nurse-led but interprofessional work group that got together to collaborate on preventing hospital-acquired pneumonia prevention by engaging nurses. Started in one VA hospital in Salem, Virginia, and now has been scaled in all 155 VA hospitals and long-term care facilities. And from that work group emerged a national organization called NOHAP, the National Organization for the Prevention of NVHAP, with a website that you can check out. The website is here. And what Project Happen is based on, next slide, Jessamine, is an oral hygiene protocol that is implemented by nurses and certified nursing assistants in the VA system, actually throughout the VA systems. And what it consists of is a standardized evidence-based protocol that requires that patients entering a hospital or long-term care setting receive an assessment to determine their ability to participate in oral hygiene while in the hospital or long-term care setting. And the assessment determines how often each day a person needs to have their oral hygiene needs met, either independently, as you can see from the top of the diagram, through self-care, or with staff assistance, or is the patient dependent for oral care and requires a nurse or a nursing assistant to administer it? Are they totally dependent on oral care such that they are not even conscious to participate in that dependent care? And is denture care being provided for patients with no teeth? There are patients who are in hospitals nationwide whose dentures are never removed while they're in the hospital, nor are their dentures brushed and cleaned. And what a climate for developing mouth sores as well as oral infections that are transmitted to the lungs. So using the VA protocol, oral hygiene is implemented independently to totally dependently 2 to 4 times a day. And that, along with the positioning, elevation of the head of the bed, ambulation when possible, et cetera, that Jessamine just mentioned, are the elements of the protocol that have been found to significantly, almost completely, reduce the incidence of NVHAP in VA institutions. It has saved hundreds of millions of dollars and literally reduced the incidence of HVAP almost completely in those settings. So one of the elements, and it sounds like a simple but very pragmatic element, is that in order to implement this protocol, the VA, like any hospital or healthcare system, long-term care facility, had to ensure the availability of oral care supplies for patients in a logistical supply chain kind of way. Basic supplies included items as simple as toothbrushes and toothpaste, but also dental floss, oral rinse products, and denture cleaning products as well. They track the number and rate of NVHAP, acquired pneumonia infections, according to individual units in the hospitals and long-term care facilities, and then for the institutions overall, as part of the quadruple aim quality improvement measures. And a big part of this was oral health literacy, not just for patients and families, but for the staff, because we all know that when staff, as well as families and patients, are not knowledgeable about and don't feel comfortable with implementing a new standard of care or a new self-care practice, it's not done. It's certainly not done consistently or to the extent that we want to. So that thousands of hours have been spent educating clinicians across the VA healthcare system. Now, today, next slide, Jessamine, this very successful initiative, and I happen to be fortunate enough to be part of their expert advisory board. There's numerous papers published about this. One of my favorites is in the Journal of the Michigan Dental Association and is on our reference list. But this is a white paper that was recently published that I was fortunate to be part of, that outlines the entire NVHAP call to action. And this is in the Infection Control and Hospital Epidemiology Journal. Pretty good, huh? Anyway, and there are numerous papers, but if you really want to read something that acquaints you with it, read the article in the July 2019 Journal of the Michigan Dental Association. Next slide, please, Jessamine. And this initiative has such an important impact and potential for scaling outside the VA that David Baker, who is the Senior Vice President for Quality at the Joint Commission that you know accredits all hospitals and primary care practices that are associated with hospitals and specialty practices as well. They issued a quick safety alert about the importance of preventing NVHAP, and this is a precursor to what we hope will be the eventual adoption by the Joint Commission of NVHAP and oral hygiene as required standardized quality indicators that hospital systems, healthcare systems have to demonstrate evidence of when the Joint Commission visits to recertify or accredit their institution. So this is very important attention to this very important issue and preventable issue. It's like caries, preventable largely. Next slide, Jessamine. So other interesting policy updates related to scaling this initiative outside of the VA is that the Press Ganey company, which is in charge of, it is a quality improvement company, essentially, that has a major influence on what is regarded as standardized quality measures in healthcare. They do all the patient satisfaction surveys. They do the National Nursing Database indicators, NDNQI it's called. They are very interested in this. Their adoption of NVHAP and oral hygiene as a quality indicator in the NDNQI set of quality indicators would power system-wide transformation of healthcare organizations across the country to include oral health as an NVHAP quality indicator, like prevention of pressure ulcers, like prevention of catheter-acquired infections, prevention of falls, prevention of central line infections. Hospitals have to comply or they get fined. So this is really important, both in terms of quality, cost, and patient satisfaction. Additionally, another informatics team is working with SNOMED to develop SNOMED IT terminology for NVHAP that are being reviewed by the National Quality Forum for inclusion as a standardized clinical terminology for electronic health records. And that would locate oral health as part of the standardized terminology for documentation of client data in EHR, which paves the way for this to be a required documentation field in the electronic health record, not in dental offices, but in primary care, specialty care, hospitals, and long-term care settings. That is major. And as Jessamine mentioned, in the new Oral Health in America, Advances and Challenges, there is one paragraph on ventilator-acquired pneumonia, which is the critical care version of this, which also has oral health in its evidence-based practice bundle. And there were 3 mentions regarding pneumonia and the importance of oral care in its prevention and management. Next slide, please. So you can also find more information about this. The National League for Nursing has a caring, Advancing Care Excellence series for seniors and veterans, where we have integrated oral health in this, in terms of teaching our students, nursing students, to prevent NVHAP. We have the Onup Undergraduate into Professional Oral Health Faculty Toolkit that features strategies to integrate this into undergraduate nursing curricula. We have this NOHAP social media site, and you have the link to that from an earlier slide. Next slide, please. This is the undergraduate ONEP toolkit. Next slide, please. And join us for our live tweet chat on February 28th at 2 p.m., where we are seeking partners to engage with us in our tweet chat that will focus on NVHAP. And we sent out an invitation for you to join us, and any and all are welcome. And please follow us on Twitter at our All for Oral Health site, and contact Jessamine about participating in our tweet chat on the 28th. Next slide, please. And so the VA team was comprised of nurses, physicians, IT people, dentists, dental hygienists, but it was a nurse-led team. I like to brag that Shannon Monroe, a nurse practitioner, was the leader of that team. But it really took a partnership to make this happen and to scale this innovation, this simple sounding innovation, and to bring it to a national presence and clinical standard of care. So we can take it further. We invite you to join us and the VA in spreading the word and making this happen in even more ever widening circles of care. Thanks, everybody. And we now have some time for questions.
I see in the chat, someone asked about the quick safety document, and I will put that link in the chat promptly. These slides will also be made available after our presentation today for anyone to view.
Yeah.
I have a question.
And as a result, we have really cultivated a number of champions, including one in the what is it called? In the Joint Commission, Dr. David Baker, who is an MD, and he's really thinks that this is a great initiative. So we look forward to his continuing support.
Is there a
Dr.
question?
We had somebody, yeah, we had someone speak up. If you'd like to unmute yourself again to ask the question.
Okay, yeah, my name's Karen Hall, and I work in a hospital actually in Oregon, and I'm a dental hygienist. And I love this presentation, and I love the idea. My nurses, the nurses that work here at the hospital in the ICU, when we have ventilated patients, they get really great care every 4 or 6 hours. I don't remember exactly which.
Right.
And then the non-ventilator patients, I'm pretty new to this position, so I'm treading lightly, but I feel like if the patient says they're brushing, or if the patient says to the nurses that they don't want to have help, then the nurses don't do it. But then when I go in, they usually let me come in and check them or brush their teeth or whatever, and their mouths are usually not very clean. But they oftentimes let me brush their teeth. But so I've had a few nurses hint to me that they're hesitant with me there, even because they're afraid that I'm going to enact some new law that they have to start brushing people's teeth, you know, like 5 times a day or whatever, you know, like at the beginning when I first started, they were just like, so what exactly is your role? Are you going to be like making us do more work, or what exactly are you doing? So I think I haven't done that yet, but so while I'm listening to this, and I think this is all great, I'm just a little nervous that I'm going to make enemies, but I like the concept that it's going to come from as part of their I don't remember how you worded it, but part of their quality metrics, because I know that they're always worried about the, you know, pneumonia. They talk about pneumonia like it's a big deal. And of course, the pressure ulcers and stuff like that, they're always very conscious about that. So, you know, I'm very interested in it coming from that level. But if I were to bring this presentation, you know, who would I bring this to? Like at what level? Like the nurse that's in charge of everybody, or who would you recommend?
Well, you could bring it to, first of all, one of the most important things is to cultivate champions, and whether they are formal or informal leaders, but someone who really gets it. Every hospital, and did you say you're from Oregon?
Yeah.
That is one of the most progressive states in terms of conceptualizing integrated healthcare and the importance of oral health and overall health. But if you have a quality improvement committee, which every nursing department in every hospital has to have, and that is the department that is responsible for all of the monitoring and surveillance of and reporting of these quality indicators. And when you can demonstrate that a hospital can increase patient satisfaction, save money, and improve the quality outcomes that occur by instituting a new best practice, I'll bet they listen to you. But you have to think about presenting it. And we're more than happy to collaborate with you on making that happen. But I think it's great that you're involved in that way.
Great, thank you.
Oh, Barbara Quinn. Oh my God, one of the gurus of this.
Hi there. Hi there. Can you hear me?
Hi, how exciting.
Oh my gosh. First of all, I'm thrilled to meet you. Such a wonderful professional and example for all of us. But yes, I have studied this for over a decade. You know, started in one unit at one hospital. We've spread this throughout our whole Sutter Health system here in Northern California. And so I can't tell you how thrilled I am and how totally supportive of moving this forward the way you are. And congratulations on an excellent presentation. I love how you use the protocol, and very excited to hear about the policy progress. I had not heard about Press Ganey considering this, and also NQF. I had not heard those things. So thank you for bringing us up to date. And we are busy here too, taking all the Joint Commission and the NOHAP call to action, all those things to our infectious disease group and adding it to we've actually added it to a dashboard measure.
Right, exactly.
Our quality dashboard. But we feel like we're sort of lonely in the woods right now. Not too many people doing that. So thrilled to have this getting out there more widely. And I will definitely be on your tweet chat.
That's great. And Barbara is one of the authors of many of the articles about NVHAP prevention, along with Shannon Monroe and Diane Baker. They are the three nurses, among other interprofessional colleagues, who are authors of this wonderful collection of evidence-based literature. So great to have you. So lovely to see you.
My pleasure to join. Thank you for doing this.
I know that the VA team is talking to Kaiser about their adoption of this as well. And I think other healthcare systems as well. But you know, this all takes time.
It does take time. Kaiser actually started their oral care program as part of a bundle. About the same time we started it in Sacramento. But what they found was they were trying to screen to see who's at risk and then apply the oral care, the mobility and all that. But what they learned was that almost everybody was at risk. And that's why this should be a standard of care and not a risk screen
Right.
sort of an idea. So there's some new studies out now that really validate that, that really all patients in the hospital are at some risk.
Right. Any other questions? Do we have time for any more? Or do we have to end, Valerie?
Nope, we can, if there's still questions, yeah, we can definitely keep going.
Hi, Judy. This is Dora.
Oh,
From
Dora,
England.
hi.
How are you?
I'm good. How are you?
I was just checking my email before, and I'm like, oh my God, it's today. I cannot miss this reunion. And no, I'm thrilled that you're presenting this. You know that I've been working on this subject for 15 years. And
At NYU, at
at
NYU.
NYU. Correct. And so since we have now so many sites, we've been trying to, enlarge our expertise, let's put it that way. We have standardized oral care on our main campus, and we have began also in the past 2 years, right before COVID. We started using kits for the non-VAP patients, and we didn't know how bad COVID was going to be. And every patient received oral hygiene with those non-VAP kits, regardless, except those who were vented. They had their kits for every 4 hours, but every patient received oral hygiene Q4 hour. I mean, 4 times a day at least. But that's how we had on December of 2019 in service the staff on these new kits that were coming for the non-VAP, because that was our plan to have kits for the non-VAP patients, which are patients who are unable to do oral care for themselves. Um, and um, and before we knew it, COVID came, and it was like, wow, everybody has to do oral care. But now that it has, come down quite a bit, we've re-in-serviced the entire staff. And I think we're going to move forward to the other sites, because they're not familiar. They have to use the same oral care assessment tool that we created 10 years ago. So we're trying to spread that knowledge, so that we can get across, um,
Yeah,
more clear on what we want. And yes, it came from nursing, who started
yeah,
this oral health. And you're right. You need a champion and multiple champions to spread the word and continue it, and we're hanging in there.
good,
Um,
good, good team. Dora
yeah,
is a pioneer in doing this, even before we knew anything about the VA NVHAP, NOHAP, Project Happen initiatives. So keep going, Dora, and we're always to help you.
thank you. And I'll try to make the 28th.
Okay,
Uh, all
great.
right. Okay.
Yep, we're counting on you. Anybody else? Oh,
So we had one question in the chat. Have you partnered with the American Dental Hygienists Association? In my time, we haven't connected with them too closely. I don't know, Dr. Haber, if we've ever connected with the Dental Hygienists Association.
they definitely know about this initiative, and they certainly know all about ONEP and our activities. And we have presented at their conferences, but we do not have a formal partnership with them on this initiative. We really consider ourselves to work very interprofessionally, and certainly always welcome dental hygiene partners as members of interprofessional teams that we work with.
Dr. Haber, I might just add, if you'll allow me, we did have a pretty good partnership with the American Dental Association, and their board approved the oral care protocol for adults in hospitals. Was published in the American Nurse. Well, no, where was it published? Was published somewhere in one of those articles, but it is out there, and that's what the Happen project was based on, oral care protocol.
Okay. Well, thanks for that information. I did not know that.
So someone had asked about the National Oral Health Conference, the National Oral Health Coalition. I don't believe we were able to present or set up a presentation with them this year, but we have presented with the NOHC in the past.
Absolutely. It's one of our favorites. Okay, if there are no more questions, then we'll say goodbye and thank you all for attending. And please join us at our tweet chat on the 28th. We look forward to seeing everybody. Take care. Thanks.
Thank you, guys.
Bye.
Thank you so
Bye.
much.
Thank you.